something that will inevitably affect all of us one way or another. Social care. According to Age UK, already 1.4 million people are not receiving the care they need, while others face catastrophic costs. And now a poll from the Health Foundation shows that nearly 2/3 of the public are willing to pay more taxes to fund social care, but say they should not have to sell their homes. Our health and social care correspondent, Victoria MacDonald, reports.
Christmas card. Merry Christmas, it says.
Jean Hales has had a heart attack, needs dialysis, struggles to walk. Her husband Len has had 2 strokes.
You find it difficult to wash yourself or get dressed?
Well, yes, because I can't stand on one leg, or 2 legs come to that. So, you know, I've really not got any hands to wash myself with. It's all bleeding.
Hello, Jane, you all right?
Now a carer comes to help the 84-year-old twice daily after a spell in hospital lasted 8 weeks because doctors said she needed help. But the couple don't know who is going to pay for it and what it might cost. Managing all this with only one hand, Mr. Hales says he is tired.
If they take away the care, how would you cope?
The answer to that is, I think, with the greatest of difficulty. I look at it on the basis we've worked all our lives, we've paid all our taxes, and yet we're still expected to, well, if necessary, sell up.
A familiar theme the Prime Minister is said to have taken on board when he stood on the steps of Downing Street and promised to resolve the problem. Yet it makes political parties nervous. After all, it nearly derailed the Tories in the last election. So details this time have been scant in the party manifestos. The Lib Dems visiting a care home today have pledged a joint health and social care budget, and like the Conservatives have said they will build a cross-party consensus on long-term funding. And Labour has said it will introduce free personal care for over 65s and will cap costs, similar to the Scottish system, which is free but according to need.
Whoever goes through that door next Friday will have to deal with the social care crisis. It's become too acute. It's now more than 1,000 days since a green paper was promised. Yet my understanding is that that paper only offered options, not solutions. And when Boris Johnson's team looked at it, they were taken aback by how much work still had to be done.
And this is what they will confront. A poll today for the Health Foundation shows 46% believe means testing is unfair. 62% said selling their home to pay for care was unacceptable. And the same number say they are willing to pay more in taxes.
People just simply don't understand how social care is funded. They think social care is free, and it is a terrible shock when they realise that it isn't free, that only the people who have the least means and the most needs get free care, at the moment paid for by local authorities. Everybody else has to contribute.
At this South London care home, 60% of the residents pay their own fees, which they actually don't seem to mind.
How do you feel about the fact you had to sell your home?
Well, I knew it was inevitable. I mean, I wasn't going to use it anymore, so therefore it had to be put to good use. I was always brought up that what you get, you have to work for.
But this means a shortfall between the cost of care and what the local authority is willing to pay.
We have residents here from all different local authorities, and they're all paying totally different amounts. A typical rate might be £600 or £700 per week, and the cost is more like £1,000 per week.
Here they rely on relatives and a charity to bridge that gap. Not everybody has that luxury.
Now, Joe Swinson